Today in this lecture we are going to discuss a new topic in medical surgical nursing. So that is general physical, that means physical it might be whatever, general clinical examinations, that means investigations, what are all the investigations, what are all the laboratory procedures required for a client's disease condition. In general we will discuss, say for example, so if a client is admitted in a hospital, so what are all the laboratory investigations and what are all the diagnostic procedures which healthcare professionals will conduct, those all in general, what are all the types and what is its function, how the diagnostic procedure is useful to diagnose a particular disease, we'll discuss one by one. Okay, so today our topic is general clinical examination, right? So here general clinical examination is nothing but it is a process, or it is a segment in a clinical research where a healthcare professional or a investigator or a laboratory technician finds rules out or finds out a particular, to diagnose a particular disease is nothing but a general clinical examination. Okay, so normal health history and the physical examination is different, but to rule out the internal cause of disease, this yes, definitely these clinical investigations were done. Okay, so for example, there is a disorder within the blood, you can't examine you can't rule out that, or you can't find that, you can't evaluate that on doing physical examination, right? By inspection or palpation or percussion, whatever, you can't find out the exact cause or exact disease which is persisting in the blood. So for that what you do, blood test, right? Blood examination, right? So like that, so there are certain general clinical examinations which every healthcare personnel or in a hospital setting were done. So we will discuss one by one. Okay, so yes, our topic is general clinical examination. I'll just list out the things first, then we will discuss one by one. Okay, so totally there are 10 most important in general clinical examinations or clinical investigations done in a hospital setting. Okay, so we will discuss one by one. So I'll just list out first all of them. First it is blood examination. Yes, then next one, urine analysis, or you can call it as urine examination. Then next, sputum analysis. Yes, then next, semen analysis. Yes, then next, ECG. Yes, then next, EEG. Okay, so yes, semen analysis, then next ECG, then next EEG and MRI, then yes, X-ray, yes, then next biopsy and aspiration of body cavities. Yes, these are all 10 most important clinical investigations or clinical examinations or laboratory procedures which you perform for a particular client or for a particular disease, or to rule out a specific disease in a hospital, right? So first one, it is blood examination, then next urine analysis, sputum analysis, semen analysis, ECG. ECG is nothing but, yes, here electrocardiogram, okay, or electrocardiography, whatever you can call. Electrocardiography, okay, yes. Then next EEG, nothing but electroencephalography or electroencephalogram, whatever. Then next MRI. MRI is nothing but magnetic resonance imaging. Okay, then next, yes, X-ray. Then next biopsy, yes, aspiration of body cavities. Okay, so these are all 10 most and major important diagnostic procedures. So in every hospital setting is done. So in general hospitals, not specific. Okay, say for example, other than this, there are like other diagnostic procedures. If you see others, yes, in that first one, USG. USG is nothing but ultrasonography. Yes, ultrasonography, here it is nothing but, so it might be of abdomen. Ultrasonography, nothing but it visualizes the organ or the growing part or abnormal growing part within a specific organ. Yes, say for example, ultrasonography of pregnant women. Yes, so in that ultrasonography, what we can rule out? Yes, the growth of the baby, yes, and the movements and the amniotic fluid, the uterine cavity, the part which is, or the fetus which is growing in the amniotic cavity, yes, or the uterine cavity, we can rule out. Yes, that is something about like in general USG, ultrasonography. Okay, so say for example, a patient complains of like a pain abdomen. Yes, we can rule out. Yes, so whether there is any tumor or whether there is any infection within the intestines, or there is a like flip of the intestines, so that to rule out a certain diagnostic procedures, definitely here ultrasonography is done. Okay, not only for abdomen, yes, ultrasonography is like it might upper abdomen or lower abdomen, yes, pelvic region, yes, to that entire we can do. Okay, then next CSF analysis. Yes, CSF, here it is nothing but cerebrospinal fluid. Okay, CSF analysis. Yes, so why here, what is the CSF analysis? Where is this CSF is present? Yes, within the like midline of lumbar vertebrae. Yes, near the that entirely passes, right? So from the lumbar vertebrae near the L4 and L5, we just collect the CSF. Why? To rule out any like something infections or inflammations related to brain and spinal cord. Okay, say for example, meningitis. Okay, so meningitis means inflammation, or if there is any like changes or abnormalities within the spinal cord and brain. So to rule out all those diagnosis or diseases, we just perform CSF analysis. Okay, yes, then next, yes, stool analysis. Yes, stool analysis. Why do you perform, what is stool, right? So the rectum, feces, right? So the feces which excrete from the rectum and the anus is nothing but a, so that is a stool. So why we perform here a stool analysis? So when there is any abdominal infection, or when there is any, say for example, every year, like you know, definitely in certain general examinations, when you go to a general health checkup, definitely abdominal examinations were done. Yes, and moreover, stool examination is mostly done in children, right? Why? Because they are more prone to opportunistic diseases, and they are more prone to airborne diseases. Yes, airborne, waterborne diseases, right? So for that reason, in children, mostly abdominal, like you know, diseases related to like peritoneum cavity and respiratory issues, digestive issues, and yes, those are all, and the patient or the child may land up in malnutrition, and yes, nutritional disorders, when there is any nutritional disorders. So definitely when there is any infection within the abdomen, intestine, stomach, so definitely a stool examination here is done. Say for example, the client or the child is having diarrhea. Yes, stool examination, to rule out the consistency and any pus cells were discharged there, any blood is excreted out there. So to rule out certain things, or there is any fibroids. So in adults, the most important thing is nothing but a fibroid. So is there any fibroid going under, like you know, growing in the anal region or the rectum region? So to rule out all those things, yes, definitely stool analysis is done. So these are all other, that means not major things. So other things which are done. So in the hospital settings, that is ultrasonography, CSF analysis. Then next is stool analysis. Okay. So now we will discuss our main parts one by one. That is, first we will discuss about yes, blood examination. Okay. Okay, so your first one is nothing but blood examination, or you can call it as blood test, right? So here blood test, not a medical professionals, normally every most of the persons call it as blood test, right? So our medical professionals, what do you call it as? CBP. CBP is nothing but complete blood picture, or CBC you call it as complete blood count. Okay, so what we call it as, so in blood examination or in blood test, what is the normal thing we do? That is nothing but a CBC or CBP. Yes, that is complete blood picture, or yes, complete blood count, whatever you can call, anything is okay. Okay, so here complete blood picture, here is nothing but a blood test which is performed within the hospital setting to rule out any abnormal changes within the blood or abnormal findings within the blood. Okay, that is nothing but a CBP. So when we do CBP, so here what are all the signs and symptoms? When the client is having particular symptoms, yes, the doctor orders for a particular lab investigation. So what are all the criteria when we do this CBP? So when the doctor advise CBP to perform, yes. So when if you have a question mark,